This training session will cover scheduling in TherapyNotes. If you're new to TherapyNotes, we recommend watching our Getting Started training session first to prevent any confusion. To follow along in TherapyNotes, please make sure you have the practice scheduler or clinician role. Scheduling your appointments in TherapyNotes is the first step to using our integrated workflow. Scheduling accurate appointments will make writing notes and billing easier. There are several ways to schedule an appointment in TherapyNotes, but the most common method is to go through the Scheduling tab from the sidebar navigation menu. On the right, you'll see the Calendar View tabs, which let you decide how you would like to see your schedule. Right now, we are viewing the Agenda view, but you can change to view the day, week, or month. What you're looking at now is the calendar. To the left, you can use the Jump option to quickly navigate through past and future appointments. If you're the only clinician on the account or are logged in as a clinician without the scheduler role, you'll only see your own appointments, which will be color-coded by appointment type. Clicking on Set Calendar View, you may also choose to hide missed and canceled appointments, only show patient initials, which locations you can see, and other optional configurations. Once you've made your selections, click Set Calendar View. Create Appointment. Now that you have the calendar set to how you want it, you can begin making appointments. To add an appointment to your calendar, click New in the upper right corner, or click the small plus sign button in the upper right corner of a date. The first field you'll need to complete when creating an appointment is the Appointment Type field. What you'll select for this field will determine which clinicians will be able to be scheduled for the appointment, which note template will be available to the clinician at the time of the appointment, and which service codes can be used with the appointment. To demonstrate this, we're going to jump down to the service code field. You can see that while the appointment type is therapy intake, we have certain service codes available. But if we switch the appointment type to therapy session, the codes are now different. The appointment types also include schedule events for administrative tasks, unavailable events to block off time you aren't available, and extra availability to make additional time slots accessible for scheduling. Next, we're going to select Patient, Clinician, Location, Service Code, Scheduled Time, and Duration. If you would like an appointment to appear on a regular basis, you can use the Frequency field to make a recurring appointment. This applies for both clinical and non-clinical appointments. Below the frequency, you'll see the Appointment Alert field. The Appointment Alert field allows you to add additional information to an appointment for easy reference. Once you're satisfied with the information in the appointment, you can add it to your schedule by clicking Save New Appointment. Now that your appointment has been saved, you can read the text of an appointment alert by hovering your cursor over the appointment. Canceling, deleting, and missed appointments. As you continue running your practice, you may find yourself having to cancel an appointment, mark an appointment as missed, or delete an appointment entirely. To do any of this, start by clicking the appointment from the Scheduling page. Canceling an appointment should be done when an appointment was scheduled correctly, but the patient contacted you beforehand to say that they would not be coming. To cancel an appointment, click Cancel Appointment. If you would like to do so, you may also charge the patient for canceling by clicking Charge Fee, checking the box for Charge a Fee for this missed appointment, entering the fee charged, and then clicking Save Changes. If you'd like to charge a fee, please make sure you have either the Practice Biller role or Biller for assigned patients only. To undo canceling an appointment, click Reinstate Appointment. If a patient doesn't appear for an appointment without prior notice, that's a missed appointment. To mark an appointment as missed, click the appointment, then click Appointment Missed. Just like with a canceled appointment, you can charge a fee for a missed appointment and can undo marking the appointment as missed by clicking Appointment Not Missed. If you'd like to document more details about the appointment, click Create Note, then fill out the relevant information. You can also choose to charge a fee while completing this note if you haven't done so already. Now, if you've incorrectly added the appointment and want to remove it from the schedule completely, click the appointment, then click Cancel the appointment as you did earlier. Once the appointment is canceled, you can delete the appointment by clicking Delete, then confirm by clicking the Delete Appointment button. Keep in mind that if a clinical note has been written for an appointment, you won't be able to cancel the appointment, delete the appointment, or mark the appointment as missed. Before we continue with this training session, we'd like to remind you that if you have any questions, you can find additional resources by clicking Help within the User Options section. This will bring you to our Help Center, which contains numerous articles and videos explaining how to use TherapyNotes. If you'd prefer one-on-one assistance, you can give our support line a call or send us an email. As always, our support is unlimited and there is no additional cost. Therapy Portal. If you have the client portal enabled in TherapyNotes, you can allow patients to request appointments directly through the portal. If the patient makes such a request, you'll see a new item on your to-do list. The requested appointment will also appear on your calendar, but with diagonal stripes going through the appointment. When you click on the appointment, you'll see an additional set of options. To add this appointment to your calendar, you'll need to select the patient this appointment is for. If the patient was logged into their portal account while requesting the appointment, they will automatically be selected. For patients that don't have a portal account, you'll either need to match them to an existing patient or click Create New Patient and add them into your account. After the patient is selected or created, you may confirm the appointment by clicking Save New Appointment. Following this, the patient will receive an email confirming the appointment has been accepted, as well as the time and location. If you would like to decline the appointment, click Decline Request. If an appointment is declined, the patient does not automatically receive a notification. You'll want to contact the patient using their provided contact information and explain why the appointment was declined and make other arrangements. If you've declined an appointment request by mistake, you can undo the decline by clicking Undo Declining Request. If you'd like to review your appointment requests, go to the Scheduling section, then click Appointment Requests in the lower right corner. On this screen, you'll see your appointment requests and get more information by clicking on them. If you're not seeing the request you're looking for, go to Custom, then adjust the parameters until you find the request that you're looking for. Appointment Reminders. Next, we're going to talk about appointment reminders. Enabling appointment reminders is one of the easiest and most cost-effective things that you can do to reduce the no-show rate in your practice. To enable appointment reminders, you must have the practice admin role. To turn this feature on, click Settings from the User Options, scroll to the Portal and Scheduling section, and click Patient Appointment Reminders. If unchecked, first check the box next to Enable Patient Appointment Reminders. Scrolling down, you'll select the type of reminders you would like for the default patient settings. Once you choose an option, that will be the type of reminders sent to patients unless the setting is changed under a patient's Patient Information tab. While TherapyNotes generally recommends enabling appointment reminders, another option is to set the default patient preference to No Reminders unless enabled individually in the Patient's Info tab. This way, a patient won't accidentally be contacted without authorization. Under Email Reminder Settings, you can select where you would like the replies to appointment reminder emails sent. Please note that this email needs to be the email of a staff member with the practice scheduler role. When you're using voice reminders, the way your practice name is spoken may not match how it should be pronounced. You can check how the practice name will be pronounced in a voice reminder by clicking Send Test Phone Reminder, entering your phone number, then clicking Make Test Phone Call. If the name isn't pronounced as you want it, enter the name phonetically in the Spoken Practice Name field. Send another reminder to yourself, and then repeat the process as required. If you'd like to see how your email and text reminders would look like, click the corresponding buttons in the lower right corner, then follow the instructions. Once your appointment reminder settings are as you want them, click Save Settings. Calendar syncing. Now that you know how to set up your schedule, you'll probably want it easily accessible for when you're not at your computer. Fortunately, TherapyNotes is cloud-based, so if you want to access TherapyNotes on your phone, you can open your mobile browser, then log in like you would on your computer. However, if you'd rather look at your schedule on your favorite calendar platform, you can sync your TherapyNotes calendar to an external calendar. To do this from the scheduling page, go to Sync in the lower right corner. Alternatively, you may go to Settings from the User Options, scroll to the Portal and Scheduling section, then click Sync Calendars with other applications. If you haven't done so already, click Enable Synchronization with other programs. The instructions for syncing your calendar are going to be different depending on which platform you're using, so you need to find and follow the correct set of instructions on this page. If you're a practice scheduler, you'll be able to sync the entire practice schedule, while individual clinicians can only sync their own schedule. These links should be kept secure, and if you feel someone has gained access to them, you can disable or change them. Once the calendar has been synced, patient names will appear as patient initials, which protects their privacy. Please note that for your security, this feature only allows a one-way sync from TherapyNotes to the external device or program. That concludes our scheduling training session. If you need additional support, check out our Help Center to access our library of articles and videos. If you prefer one-on-one assistance, our support team is available 24 hours a day, 7 days a week. To try TherapyNotes for yourself, visit therapynotes.com and sign up for a free 30-day trial. Thanks for watching!